I am sorry to deliver this news, but your loved one has been diagnosed with a serious and possible terminal illness. When a loved one begins to decline medically, there are a lot of decisions that must be made by both the patient and the family. There are several approaches to care that may be considered. These include curative care, which means the patient is going to receive care with the focus being to cure the illness, palliative care, and hospice care. Individuals hear these terms and they become frightened. The thought of hospice and the end of the life cycle for their loved one can be absolutely terrifying. Today I'm going to share information on palliative care and hospice care. I'm going to share the differences between the two in hopes of enlightening you, and when the time comes, you know what to expect. Palliative care is defined as medical care for patients with a serious illness. Palliative care can be used in conjunction with curative care. Palliative care, while still receiving curative care, is intended to provide the patient with a quality of life and comfort, while also continuing to receive treatment for the serious illness. Palliative care is an optimal option for the patient when the patient and the family are not prepared to end efforts of curing the illness and are not ready to cease a current plan of care for curative treatment. When a patient is on palliative care, they are followed extremely closely by a team of healthcare providers. As healthcare providers follow the patient, they are closely monitoring the progression of the serious illness as well as the patient condition. If the patient and the provider feel that the patient's illness is not improving, or if the patient's condition is worsening, they may begin discussing with the patient and family the option of focusing from curative and palliative care to just palliative or comfort care. This is when a provider may bring up a discussion about admitting the patient to hospice care with the patient and their loved ones. Hospice is defined as holistic care that the patient and their loved ones receive when all possible curative treatments for the terminal illness have been ceased. Hospice care provides care to keep the patient as comfortable as possible and their final months and moments earthside with their family loved ones. Providers may recommend hospice care for a patient once they feel that the patient has less than 6 months left to live, with the terminal illness continuing to run its natural course with no treatment or plan of care. Hospice care not only focuses on patient comfort, but they also provide emotional and spiritual care and support for both the patient and the patient's loved ones. It is very common for a patient to choose to receive hospice care in the comfort of their home so that they can pass peacefully, surrounded by the things that are familiar to them, their family, and their loved ones. Hospice can also be implemented in a facility setting if that is what the patient and the family prefers. Hospice is a wonderful tool to provide the patient and family care and to help with the transition from life to death for both the patient and their loved ones. Hospice often provides bereavement support for the family up to 1 year after the passing of their loved ones. This is a wonderful tool because if you've ever lost a loved one, you know the hardships that a family goes through after losing a family member. The thoughts of a loved one being diagnosed with a terminal illness can be terrifying to the patient and to the family. Care teams are here to help care for the patient and provide the support that the patient and the families need. It is important to speak with your care team and your loved ones regarding the wishes while they are still well enough and able-bodied to do so. I hope my presentation has positively impacted and educated at least one person today. End of life can be extremely difficult and terrifying, but with the help of palliative and hospice care, it does not have to be. Thank you.